But I would agree with you. All right, next we'll take up Senator Surovell's 1289.
Thank you, Mr. Chairman. Can I present that from here?
Sure, go ahead.
Thank you, Mr. Chairman. First of all, I'd move my substitute.
All right, I move and second to adopt the substitute. All those in favor say aye.
Aye.
Okay, the substitute's before us.
Thank you, Mr. Chairman. So the bill that is now before you is a shadow of its former self. The bill as originally introduced was an attempt to had a lot to do with health insurance contracts and anti-steering of hospitals and some other stuff. The bill that is remaining, all it does is it basically says that in every contract with an insurance company, there has to be a provision in there that prohibits the medical provider from discriminating against their patients who are involved in litigation. And the reason that's important is because there are it's come to my attention, at least over the last 24 years, that there are some providers who screen out potential patients who have insurance based on the fact that they were in an automobile accident. And these are people who have insurance, and typically these providers are not supposed to turn these types of people away. I've negotiated this language with the hospital association, the medical providers. I believe that they're fine with this language remaining in the bill. The rest of it is going to go to the HERC and be studied in the HERC over the summer, and that's basically what the bill does.
Okay. So what you're saying is that apparently doctors are, if somebody has a particular condition as a result of an accident or something else, they can't say, well, I can't treat you?
Right, Mr. Chairman, basically what happens is somebody will get in a collision, they'll call up an orthopedic surgeon and say, I'd like to make an appointment with Dr. So-and-so. The receptionist will say, how are you hurt? They'll say, I was in a car accident. They'll say, Dr. So-and-so doesn't see people that are in car accidents. That's typically what happens. And it's probably a violation of the existing health insurance contract, but the insurers would like to make it explicit in their contracts, and this code section would require them to put it in all their contracts, and it would create some accountability. And again, the healthcare providers were fine with that. The doctors that are doing it, I think, are kind of outliers. The vast majority of healthcare providers don't do this.
Senator Spruill.
Mr. Chairman, Senator Surovell, what's the difference between seeing a lawyer and I have referred patients to lawyers and they turn them down because that's the nature of the accident. If the accident wasn't big enough, they don't handle the case. Right,
Mr. Chairman, what I would say to Senator Spruill is that what's different about that is that the lawyer's attorney's fees are not being paid by an insurance company that you have signed a contract to pay your bills with. These doctors sign contracts with the insurance companies agreeing to take the insurance company's members or patients or whatever. And the doctors are not supposed to pick and choose which people who have the insurance they see. They're supposed to take, for example, everybody that comes in with Anthem, everybody that comes in with Blue Cross Blue Shield, everybody that comes in with Care First, everybody that comes in, they're supposed to take them if that insured person has that specific insurance. That's part of their contract.
All right. You've heard the bill. Any other questions?
Mr. Chair, this bill is significantly different from the one that was introduced, and I would like to hear from anybody from the Hospital Association if they're. I'd like to hear from some hospital people about the substitute.
Mr. Chairman, I would just note for Senator Deeds that this language was in the original bill as introduced, and we basically took out everything else except for this. But the hospital associations, I'm sure that they'd be happy to talk if they're on the line.
Do you have anyone on the line?
Mr. Chair, there are 3 people with their hands raised.
All right. Go ahead. You each have no more than 30 seconds.
Scott Johnson, please go ahead.
Thank you, Mr. Chairman. Scott Johnson, speaking as General Counsel for the Medical Society. I want to thank Senator Surovell. We worked on this language, and we have no objections to it in its current form. Thank you.
Thank you, Scott. Next.
Next, we have Brent Rawlings.
Brent, welcome.
Yes, Mr. Chair, members of the committee, just to echo what Mr. Johnson just said, we are comfortable with this language. This is very different than the bill that was introduced, but we've had a number of conversations, and on this issue, I think we've reached a comfort spot. So thank you.
Okay, thank you so much.
Mark Dix, please go ahead.
Good afternoon, Mr. Chair, members of the committee. Mark Dix on behalf of the Virginia Trial Lawyers Association. We support the bill. We appreciate Senator Surovell bringing it forward and working with our partners in healthcare. Thank you.
And lastly, we have Doug Gray.
Mr. Chairman, this is Doug Gray on behalf of the Virginia Association of Health Plans. Since this is the health plans statute, I would just weigh in that we're okay with the language. Thanks.
Can't believe that.
There are no other speakers, Mr. Chairman.
All right, you all heard it. The bill's before us in the form of
Mr. Chairman, I have a question.
a substitute.
And I have a question. All I have is the original bill. Can you tell me what part of the original bill is still here? Which lines? That might take me a second, Mr. Chairman, but I would note that under code section 38.2, 3407.15, it is subsection 13 and the new subsection C in the substitute. If you give me about 60 seconds, I can probably find the lines in the original bill if you really need it. Line 185? Hold on. In the original bill, Mr. Chairman, I believe it's around lines 187 to 196 and 187 through lines 206 in the original bill. It's roughly in there, but I believe there's been some changes to the language from the original bill. Okay. All right. Okay, thank you.
Senator Edwards, do you have any more questions? All right, any other questions? All right, we've adopted the substitute. All right, there's a motion. Do I hear a second? That the 1289, Senate Bill 1289, as an amendment in the nature of a substitute, be reported to the full Senate. All those in favor vote aye. Those opposed, nay.
Senator Norman, how do you vote?
Senator Norman votes no.
As 14, noes 1.
All right, Senator Barker, you're back for the third year in a row.
Yes, thank you, Mr. Chair. What we have here is Senate Bill 1341, which is the one dealing with the health insurance plan. This one is targeted specifically